A lot of providers tell us the same thing. I love treating patients, but running the business, that's where I'm overwhelmed.
Whether you're just launching your med spa or already running one, Moxie is the all-in-one growth system built to help you scale without the stress. With software, marketing, compliance tools, and expert coaching all in one place, Moxie helps you grow faster and more confidently.
And right now, Fill Me In listeners get $500 off their launch fee. Head to www.joinmoxie.com/fillmein or click the link in the show notes. All right, guys, welcome to another episode of the Fill Me In podcast. I'm Injector Jon.
And I'm aesthetic nurse Nicole.
It's been a minute, Nicole.
It has. And I'm very excited for today's episode because we're going to be talking about the new hot topic again.
It's all about growth factor, people. All about growth factor. Especially platelet derived growth factor.
Mm-hmm. And that is
Nicole,
everything we're seeing.
Yes,
on
you
Instagram.
Just got it at your practice, right?
I did. Yeah. So
exciting.
We decided to bring it on like a couple weeks ago, but we just got our training and really feel comfortable with it. So we just launched it to patients and we literally sold out of it in one day.
I mean, crazy.
Yeah. So we all treated each other too. So as you guys can see.
Yep. She's a little bruised.
Look at a little bruised, little swollen.
And what technique did you do though?
Definitely just a little tender. So we did needle on bone and because we're still kind of getting acclimated with the product, we did backfill BD syringes with it too, so that it was a little bit more of a smaller needle. You can just take what they give you and put like a 30 gauge needle on it. But we preferred, especially in the under eye, to just fill separate BD syringes. So it's a 32 gauge needle and you're using a new one each time.
Right.
We injected 4 people. The other 3 people are not bruised.
Oh, I mean,
it's just me.
It's the luck of the draw, you know?
Yeah. But I tend to bruise pretty easily, but I will tell you, I am pretty tender, which I think is to be expected because of the fact of the histamine response and the tissue response and the fibroblasts and all that. So, but I do think the needle probably does play a little bit more of a role in that tenderness as well, because tell the people what you typically do. You usually use cannula, right?
Yeah. I feel like I just want to preface this. Like I've gotten, I don't think the amount of DMs about PDGF is just unreal. Like protocols, what do I do? How do I dilute it? So we're going to go over like all of that and like what we do in our practices. But I personally use a 25 gauge 1.5 cannula when I do PDGF. I reconstitute the PDGF BB with 1.5 cc's of bacteriostatic saline. So it yields 2 cc's of product. So then it's 1 cc per eye. And then I use a 25 gauge cannula, right? I make the poke literally right where you would do tear trough filler. And I go to periosteum. So I'm deep. So you want to make sure with this product, you're deep.
I was going to say, good point. Like if you're not comfortable with cannula use, you should not be using cannula with this product because you do not want it in the superficial planes. You want it deep and down on bone. So if you're not comfortable with cannula use, I think needle is definitely.
And honestly, this is coming from someone who, when I first got the product, it's obviously, as we all know, FDA approved for topical use, right? Now PDGF BBs is approved for injection for other areas on the body, just not the face. But so now we're injecting it off label, like we do a lot of things in the face, but mixing it with bacteriostatic saline. When you get PDGF, we get it from a company called Essence, which is where the majority of people are getting this product from. It's owned by Lynch Regenerative Medicine. We can probably put them on here. So people listening, if you're interested in this product, you can reach out to them and they can find a local rep to hook you up and send you samples and to try it out and learn more information. But you're not using the HA serum that's in the Essence package that it comes in. You're only using that serum and combining it with the PDGF when you're using it topically.
Right. So like I had microneedling done 2 weeks ago with it, which by the way, absolutely obsessed with. Like to be completely honest with you, I wasn't expecting anything like crazy. I've worked with growth factors before. I've had exosomes at my old practice. Like I was not expecting to be that impressed. Like my skin looks like glass and within like 2 to 3 days, like the healing was so much different than with my own PRP or exosomes that I've done in the past. So I was like shocked. That's when I was like, right away, I'm like, buy it. We need it.
No, that literally it's the glass skin. Like you don't understand until you do it. And of course, you, Nicole, you've been doing these treatments for years. So like maybe someone who's never had this treatment, you might not have that appearance after one, but it really does yield better results than just doing microneedling alone. And it's different than PRP. It's with PRP, it's a wonderful treatment, right? We still obviously offer it to patients that want to use their own blood and use their own growth factors. But with PRP, there's more variability. With PDGF, you're getting up to 300,000 times more growth factor concentration.
Right.
So you're guaranteed more consistent results with it.
And for patients listening, that's because basically other factors, social, like your lifestyle, hereditary, like all these things kind of play a role in your PRP components.
Right.
So it's just like, even if you drank the night before, like your PRP can be not as potent as it could be. So
and we can't test it in the office.
Right. We won't know. Yep, exactly. And also age plays a huge role, like my PRP is going to be very different than a 60 or 70-year-old woman. So it's just that now you can kind of take that guesswork out and use something like PDGF that's going to give them as much potency, if not more.
Yeah, it's just so crazy. Like you're looking at this little baby syringe of PDGF that's 0.5 cc's and you're like, you're not going to do anything. And then with one treatment, then you do it, whether it's injecting it or, putting it topically, and you're like, oh, okay.
It did something.
It really did something.
It did a lot.
But she's really potent.
Yes.
Right?
Yep. Yeah. So how you were explaining that you mix with the 1.5. So we had done it on ourselves with actually a 1 cc dilution of bacteriostatic saline. So it was a little bit more concentrated. I do think that's why I'm a little bit more tender as well.
Sure.
And I think too, like on this one eye, if I can show you guys, you can kind of see the angiogenesis. Oh, I don't know if it's going to pick up on that camera, but like right through here, it's a little bit of like redness and some little capillaries too. So it basically works. We place it down on periosteum because that's where those fibroblasts are sitting. And it basically creates more fibroblasts, stimulates those fibroblasts so you can have more collagen and elastin. And in the meantime, it also is making more vessels and things like that. And that's why you see that angiogenesis or that redness in the area. And that's also why you have all the swelling.
Yeah. I remember when I was experimenting with it, I was like, oh, I'm just going to inject it kind of like how I do PRP, or I'll do it a little bit more superficial. And so I actually had my RN injected superficially using a cannula on me. And oh boy, did I have my angiogenesis. And honestly, I want to show you guys the picture because
we have to put it in.
And we'll put it in up here. But I of course knew that this was part of the process, and it really just started. It started the next day, and it lasted for probably, I would say, about a week, maybe up to 10 days. But like the worst part of it was like the first like day 2 to day 5.
Yeah.
And then I had a little bit of swelling, like little malar edema, probably on day 4, day 5. And then it quickly resolved by day 7 to 10.
Yep. And I remember I think we filmed like in between that.
We did.
Yeah. And you were like, what do you think? Do you think it's going to come down? I'm like, I know it will.
I was like, oh my God.
Cause it's like that, that like panic moment, but
and I'm white, Caucasian, French, like, and I'm very reactive. So
you're like me.
For me,
yeah,
exactly.
You're
get really
just like
red.
me. Yep.
So.
Yeah. And two, I think it was kind of still very new then. So techniques weren't really quite, because it's not new in the fact of like, it's not a new creation, but it's new in the aesthetic world. So they've been using it for diabetic ulcers, orthopedic surgeries, even orthodontics, I think, right? Like in the mouth.
Surgery to augment bone.
Yes. Yep. So there's a lot of uses. We're just now using it off label in our setting for aesthetics.
Yeah. And not only are we injecting it under the eyes, I'm injecting it in the smile lines, the nasolabial folds. I'm injecting it into the accordion lines. We're injecting it into the hair to stimulate hair growth, which is incredible. So we'll go through all of that. I use the same reconstitution
for all of them
for under eyes as I do smile lines and also accordion lines.
Okay.
There's sometimes I'll do like up to 2 ml, like if I just want a little bit more spread. But normally I'm using just that 1.5 cc recon. For the scalp, I use 2 syringes of PDGF BB, and I reconstitute it with 4 cc's of bacteriostatic saline. So that way I'm yielding 5 cc's of product.
Okay.
Because honestly, like when we're doing PRP for hair, like I love to get at least 8 or 9 cc's of PRP from people. You know what I mean? And that way you can spread it everywhere. So I like to have as much product as possible, especially when treating the hair.
Right. No, absolutely. I'm just pulling up my protocols.
Yeah.
Uh, where are they?
But yeah, just I think the biggest takeaway from this is to make sure, because I actually just was talking to another colleague in the industry about PDGF, and she was bringing it onto her practice. And she had thought that, we were mixing the uncross-linked hyaluronic acid serum that comes with it and injecting it under the eye, which it is a no-no. So we want to make sure if you're injecting it under the eye or smile lines, accordion lines, the hair, make sure you're using bacteriostatic saline. The only time you're using that serum that it comes with is when you're using it topically.
So after lasers or microneedling, but you never want that HA in it if you're going to be injecting. Yeah. So for hair, same thing, 1.5 cc of the bacteriostatic saline and then the 0.5 of the PDGF. And then 2 of those. Yeah. Yeah. And then depending, I guess, on if it's a large area, you might need more.
Yeah. Like I had this guy that went to Turkey and he got a hair transplant, and he came back and it was like the cap of his head. So I ended up doing 4 cc's, and I just wanted it to really just go all around. In there, we used 2.
This is a great option for people that have had hair transplants. Like it is suggested to get this after, and you may have even been told to do PRP, but this is something that's just so much more potent and predictable. So,
and that's exactly what I told that patient. He came in for PRP, and I said, we can totally do PRP, but it's a little bit more variable. And there's no way to know how much growth factor you have, but if we do PDGF, it's guaranteed and more.
Right. And I think too, with growth factors, there was quite a lot of buzz about other ones and exosomes and PDRN, and with PDGF, it's lab created, and it is sterile. And I think that's a huge component to this. There's no human component.
It's actually more sterile than your own blood.
Right. And exactly. So when we do your PRP in the office, of course, we're using aseptic technique and we're cleaning with alcohol and stuff, but we are kind of drawing that up in open air, and it's not technically fully sterile like this would be. So this actually is very, very safe compared to other ones that may have had a little bit more of controversy in the past.
Yeah. Yep.
So we're going to play around with the 1.5 bacteriostatic saline, because we did do it with the 1. So I think,
and you're going to have a great result.
Yeah. And
you're
I
just
think
going to have a little bit more soreness, I think, just because it's more, concentrated.
Yeah, concentrated. Yeah. And I think too, with that 1.5, you do get a little bit more out of it, where you could put a little bit more other areas. When you're treating the laugh line and the radial lines, are you still deep, or are you a little bit more superficial there?
I'm a little bit more superficial. And I just let them know they could have some angiogenesis, which is normal. We love it. It's new blood vessels, forming, which is great, which means new skin tissue, new regeneration. So it's so worth it.
Yeah, I think that.
Go ahead.
No, I think explaining that too, the redness and stuff, is to be expected, because with filler, you swell, but you don't see that. So sometimes it might be alarming for some people.
Yeah. And I'm not going to lie, there's some patients that I use I call it the sandwich method. So like I like to inject deep, and I'll do the majority of it deep. But for some of those patients that come in and they have that really crappy skin and that loose skin, I want to hit that skin. Yeah. So like, I like to come back and go a little bit more superficial, not too superficial where you're seeing the gray of the cannula, but just enough. So that way, you're also touching that part as well. Does that make sense?
Absolutely. Absolutely.
I don't know. Like, and I just tell them, you're going to have redness, expect it. Right. It'll go down. Wear concealer, will be good.
Yeah. Whereas when you're placing it deeper, sometimes you might not even see that angiogenesis if you're really, really deep, you'll just feel that kind of tenderness, but some people don't even get as tender as others, so it really just depends on the person. Here's a stat that should make you pause. Nearly 1 in 5 med spas open today launched in just the last year alone. The competition is real, but so is the opportunity in front of you.
That's why Moxie helps you perfect the patient experience and turn every visit into higher retention, higher spend, and long-term loyalty. With Moxie, you get elite consultation training to boost conversions, drop-off alerts to win patients back fast, automated rebooking plus reactivation campaigns.
You get memberships, beauty banks, and package suggestions to drive recurring revenue, personalized coaching to increase your average patient lifetime value, and so much more.
Visit www.joinmoxie.com/fillmein to sign up for your free 30-minute med spa strategy session and walk away with your personalized retention and rebooking game plan.
Hey guys, just popping in to remind you to like, subscribe, and hit the bell for notifications. Also, don't forget to follow us on Instagram, Injector Jon and Aesthetic Nurse Nicole. Thank you so much for watching. And if you have any questions, leave it in the comment section.
Yeah, a lot of people are saying, oh my God, like one of my coworkers said, is this going to replace under eye filler altogether? And I'm like, no, it won't replace it.
Filler still has its place. Exactly.
It still has its place. It's just so nice to have a treatment that's not filler for the under eye, because there's so many patients that aren't candidates for under eye filler.
And that actually brings up a great point. So with this product, with people that do have a lot of under eye bags or like a lot of under eye swelling, fluid retention, this is still something that you probably do want to avoid, because it's still causing collagen and elastin, and you don't want to add more bulk to that area, especially if they're already dealing with fluid retention and swelling and on and off and things like that, especially with like fat herniation. So if they have a lot of that fat herniation there, just caution, you don't, there's still the best candidate for a blepharoplasty, you still have to be careful with that. So it's not like this one size fits all. There's still people that aren't going to be the best candidates for it. So people that have like that intense festooning and things like that, this can cause more fluid retention.
It's so weird though, Nicole, because there's some patients though that even though they've had some intense festooning, I've decided to do it.
And they've been fine.
Some people, it actually improved it.
Really interesting. So I guess the thought would be, right, the angiogenesis would be because it's creating more vessels. You're thinking that you're creating more fluid retention because you have more vessels, but maybe because you're creating more vessels, you're helping that fluid actually move out of the area. I guess there is two sides to that.
Yeah. And I know. And I'm like, I had to think like, if this is regenerating everything but nerves, maybe it's just regenerating. It's giving more strength to the tendons, the ligaments of the eye, the muscle around the eye, the skin. So it's actually contracting and moving that lymphatic fluid better.
Right.
I don't know. Like, I'm just thinking outside the box.
Right. And I think too, there's a lot that we'll learn.
Yeah.
Now that there's so many more people using it in the aesthetic world, like in 6 months, who knows, maybe we'll be like, oh, that's an old thought. You can use it in anyone,
Right. Like I actually want to show this before and after, like I'll have Joey, but like this patient.
Oh, incredible.
Yeah. Her before and after.
See, I think people that have a decent hollowing, even though she has a little bit of that fat pad, like I think she definitely is a good candidate.
Well, and I don't know if you can tell, like she had a lot of anterior medial cheek loss, like volume loss. So we ended up doing obviously voluma to bone here to give that anterior cheek support and the ligament support, the under eye. And then we did 2 sessions of PDGF spaced 8 weeks apart.
That's incredible.
And then she just did her 3rd. So this is right before I injected her for her 3rd treatment. And she wasn't a candidate for under eye filler, at least in my opinion, because her skin, like it was like skin bone. That's how hollow she was. Like she had nothing there. And I felt like if I did any under eye filler, it would almost be wormy and it just would not look right.
Yep. Absolutely. You would see it. And she would have tindling.
Yeah.
Yep. So I think someone like her is like the optimal.
Yes. And I actually had someone that I've done voluma to the cheeks, to the anterior medial cheeks. I've done Volbella twice to the under eyes. Everything's been great. She came for her neurotoxin and another touch up if she needed it. And I was like, no, you're good.
Yeah.
Like you're actually good. And I was like, I don't think I need to do filler. Let's do PDGF. We ended up doing PDGF.
Incredible.
It was just beautiful. Like it ended up filling in areas that you can't touch with filler. Like,
and I think too, right? And when you think about this, it's very liquidy, so it spreads very easily. So you can give it a nice massage after, and you're going to get that whole area. Rather as with filler, it's really where you're placing it.
I know.
That's a good point too. Actually, I'm glad you brought that up. So someone that has a lot of filler, or like, we see a lot of times in our practices, like patients that maybe got under eye filler years ago and they're almost overfilled.
Yeah.
If someone like that comes in wanting
this. I just had one today.
Yeah. You have to dissolve some of that filler before you put this in there.
I had a patient today where it was a plastic surgeon who treated this patient knowing that she had under eye bags, treated them with filler, and she had Tyndall.
Yep.
And she ended up being in with PDGF under eye, and I ended up not doing it. I ended up doing suggesting dissolve and maybe getting a lower bleph.
Yep.
So that's another thing. It's really important with your patients during the consultation to know when to refer out for surgery. That's another thing too.
Yes.
Obviously, if they don't want it, then you just, can talk them through it. But this lady's going to need this dissolved if she ever gets like a lower bleph or in the future. She didn't want it, but it's okay.
Yeah, it's okay. That's what we're here for.
Yeah.
Exactly.
Yeah.
That's and too, that's actually a little off topic, but explaining to them like, listen, how long you've had this filler, 5-10 years, like you're used to seeing yourself this way. Yeah.
It was 4 years and she still had the under eye filler. I mean, under eye filler lasts a really long time.
Oh yeah. Up to like probably up to 15 years.
Don't you think?
Oh yeah. But dissolving that is like, they're not going to see themselves the same because, you know, they might be puffy now, but when you take that away, I feel like almost they might feel like they look older because that hollowing's back. Hollow. Yep.
And it's also kind of breaking down some of your own collagen, right? In HA. So like, it typically will, I feel like your own HA typically replaces fairly quickly, you know, but that area is so thin that, and with the amount of under eye filler and where it ends up, it's hard to pinpoint. I get a lot of questions from people asking, can you do Sculptra and PDGF in the same day? The answer is 100% yes. I do PDGF under eye and I do Sculptra face all day, every day. It's beautiful. It's like the ultimate biostim treatment. I feel like patients look so lifted and so refreshed after. It's insane.
Yeah.
I'll do PDGF and filler in the same visit. I've injected Skin Vive mixed with PDGF. I will say the combination of those two, you do have a little bit more swelling during those where you injected those little aliquots of Skin Vive when you mix it with PDGF, just because of that fibroblast activity. So it definitely, advise your patient. It's normal to have some of that for about up to 3 weeks, and then it finally settles.
Okay. That's something that we'll talk about in the next episode, is kind of mixing PDGF with other things like Radius and stuff like that. So stay tuned for that one, guys.
Oh, we're not talking about it now.
Oh, you're fine.
I'm kidding.
I just did on Tara, our manager. We did Sculptra right after her PDGF too.
Oh, perfect. We love it.
Yeah. That's something new that we're loving Sculptra. That's like,
it's so good. It's nice.
It just gives a nice glow, and in areas where, like, maybe someone's not open to filler and they want something that's going to stimulate their own collagen. It's a great option.
It is. And it's great. Especially there's some patients that almost need their skin primed before doing filler. So that way they can handle the filler. And
so true.
That's where Sculptra comes into play.
Yep. So true. So the biggest question on the table that everyone always asks about is the vascular occlusion risk with the PDGF.
And
it is not a concern. The half-life of the product is 2.5 minutes. So the only area that it is a concern is the supratrochlear artery. So you want to be careful in that area. So you can inject in the glabellar region, forehead, temples, but you want to be very careful when it comes to like right around here. But yeah, it's very liquidy. If it does get into the bloodstream, it's such a short half-life. So luckily that is not a concern. We did still aspirate when we did it because I'm just a psychopath, but
it's fine.
Gab actually did get on this eye. We got blood return. Yep. Oh. Yeah. So when people say you can't get a positive aspiration with a BD syringe, you can, and they're lying to you.
I had one during a private training.
Yeah. Yep.
Of under eye filler. Like, are you kidding? And it was actually so cool to have it during a private training because it was like, oh, look at it can happen.
See, it can happen.
Yeah. And don't panic. You just pull out.
Some good life advice.
When in doubt, pull out.
That's some life advice for everyone there.
Oh my God.
But I feel like that's like a major question on, from everybody is that a concern? Because with other things like Sculptra, even with Sculptra, it is a little bit of a concern.
Yeah.
Yeah.
Sure.
That's a toss up. That's in the air.
I mean, I think if you got one of those little crystals in
particles,
there, sure. But like, I don't know. I
think it definitely, you don't want any of that sea foam.
It can happen to me tomorrow.
Please knock on wood.
That's why I'm knocking on wood right now. But I have not seen it, at least personally, in 6 years. And I truly think it was the person who taught me though. And I love her, Suzanne Wilson. She's wonderful. When I inject Sculptra, I actually push as I'm moving the syringe. So as I'm
injecting.
Can you help me?
Like
as
not
I'm injecting, as I'm advancing the needle under the skin.
I'm trying to think of the opposite of retrograde.
Oh my God. It's Friday, folks. It's Friday. Oh my God.
We're okay. We're fine.
It's fine. But as I'm actually introducing the needle and advancing it under the skin, I'm actually pushing on the plunger and I'm injecting Sculptra Antegrade? Yeah, Antegrade.
I was just going to say, Antegrade.
Yeah, I'm injecting Antegrade actually.
Yeah.
So like the thought is if you're injecting Antegrade, you're actually pushing away like any vessels. So I actually have less bruising when that happens. So especially when you're trying to get that Sculptra back into the hairline where maybe that STA is kind of hiding, like it really is helpful. Yeah.
Nice.
Oh my God, that was a struggle.
No, I'm laughing because this morning I was upstairs and I was texting Kevin just to see, like, I'm like, can you make a bottle? But I set it the way that I would log it into the app. Bottle. Yeah, I set it, but like the way that I would log the feeding into the app, I literally texted, I'm like, can you make 11:45 feed?
Oh my God.
And I'm like, oh my God, I'm so sorry. I don't know why I typed that. I'm like, can you just make me a bottle?
I cannot.
Losing my mind. Oh, we should probably mention Erica and Wasim.
Oh, and of course, because they're the best. They're like the pioneers in this.
Yeah, and which just like shout out their Patreon or whatever. If people have more questions.
Too. Like Olivia, I feel like Olivia, Wasim, and Erica, like those were the three that really like I felt like, and if we're missing someone else, I'm sorry, but like at least from on my end, those are the people that really were the pioneers for PDGF for me, and highlighting it and what it can do and what made me want to inject it. And it's the best thing in the entire freaking world. If you're not injecting it, do it.
Get on board. Yeah. So definitely I would check out Olivia's page, Olivia Salmon. We'll put that on here. And then Erica, Barry, and Wasim. I don't know his last name, but they're on Patreon. They're on Patreon. They're on Instagram. They're all great resources. John's an incredible resource. He's been using this for months now too. So if you have any further questions or want to look up any other information, I know that Erica and Wasim, I think, have a webinar coming up with Dr. Lynch actually.
Oh, that's awesome.
Yeah. So that'll be a good thing for people to look into too.
Yeah. So I think the takeaways for PDGF, you don't have to worry about a vascular occlusion unless you are by this supratrochlear artery, right? Just because the half-life. Number two, when you're injecting it, whether it's the under eyes, the smile lines, the accordion lines, the hair, you're reconstituting it with bacteriostatic saline. The recommended reconstitution for under eye, smile lines, accordion lines is 1.5 cc's of bacteriostatic saline. You can use you can use needle, you can use cannula. I use the 25 gauge 1.5 cannula, and it's always injecting it deep right into the tear trough. I sometimes also will save just a little bit and inject just that lateral orbital rim, just to bone, to periosteum.
We did that on this eye here because I was a little bit hollow on the one side.
It's amazing.
And I do think too, like we've been saying, like, make sure you're injecting it deep. There is use for it a little bit more superficial too. It's just that you want to warn the patient that there is going to be swelling and that angiogenesis, that redness and all of that. But definitely where there's like etched lines, or if someone's really hollow, like you might be able to do a couple little struts. Like there is some use of it superficially.
And this is coming from someone who injected it. I've gotten injected superficially and I loved my results. I just had downtime. You just had some angiogenesis, a little swelling for 7 to 10 days, and then I was fine. So, yeah. Oh, the series of treatments, really important.
Oh, yes. That is a huge topic. Yes.
So, comparative to PRP, you want to separate the treatments 8 weeks apart instead of 4 to 6 weeks apart. That's really important.
Yeah.
I feel like with PDGF, because of how potent the growth factor is, you need less treatments than PRP to get to your goal. So obviously with PRP, you need like 3 to 6 sessions. With PDGF, minimum 2, possibly 3, spaced out 8 weeks apart, maybe. Just depends on the person and your hollowness and your goals.
Yeah. And I think like even someone like me who didn't really have anything intense in my under eye area, like I'm probably going to be good with 1. You know, there's definitely, there's also, even though it's a growth factor, I feel like you can overdo it. So you just want to make sure that you do wait that 8 weeks and you see the result before you go adding more.
And the reason why you don't want to bring them in prematurely and inject them maybe at the 6-week mark is because it's actually still working. That's how strong it is. Like, I think it's working all the way up to that 8-week mark. If you inject them too prematurely before the 8 weeks, they could just have more swelling and a little bit more angiogenesis and more downtime for their second treatment.
Yeah. So really give it the time to do what it needs to do. And I think too, like, for patients, I feel like it is a great selling point. Like microneedling, we used to have to do 3 sessions with PRP. Like now you can potentially get away with 1 session with the PDGF, you know? So it is kind of exciting.
Or you could do 3.
Or you could do 3 if you want. Exactly.
I would do 3.
Exactly.
Yep. I love it.
Yes. Well, we'll probably want to do another one of these episodes in a 2 to 3 months. I feel like, you know, as we continue to see this product
evolve and change. Yeah, I love it.
We'll keep you all posted, but feel free on Instagram and stuff. You can always ask us questions.
Yes. Leave any questions or comments about PDGF in the drop, like whether it's negative, positive, your experience with it. We absolutely love it. And we
want to hear it. Yeah,
we do. And thank you so much for tuning in to this week's episode of the Fill Me In Pod.
We'll see you next time.
Love you guys.